Well, great. Welcome to all our listeners to another episode of Presenting Our Presence. And as you know, Presenting Our Presence is a vodcast that highlights the contributions of our Indigenous colleagues here at the University of Alberta. It's co-hosted by Dr. Florence Glanfield and myself, Cindy Gaudet. And today we have the pleasure of welcoming our colleague, Keith King, future Dr. Keith King. To be with us today. So welcome, Keith. Thank you for accepting our invitation, and we'll invite you to introduce yourself in a way that's meaningful to you.
Thank you for having me. My name is Keith King. I use he and they pronouns, and I'm a proud Michif Ayakweo, or Two-Spirit, from up in Treaty 8 territory north of Peace River. I'm Métis on my mom's side. My mom is a Michif nurse, and so was my grandmother, Grandma Lil Taggart, whose mom was a Brazo. And if you trace our family tree back, you've got Brazos, Brabants, Deschanaux, Pambrons, Corchens, all across the homeland back to St. Norbert in Manitoba. And on my dad's side, I'm an English settler. And yeah, I grew up north, came down to the big city of Edmonton to go to university, and became a nurse. And I've been sort of finding my path ever since, and ended up back here at the U of A doing a PhD in nursing. So I'm really excited to be here and to share some of the things I've learned, I guess.
Thanks so much, Keith. Now, in addition to being a PhD student, I also understand that you teach in the Faculty of Nursing. Could you tell us a little bit about that work that you do?
Yeah, you bet. In 2017, I came to the U of A as an assistant teaching professor, and I actually left that role in June, but I was working as an assistant teaching professor up until this last June, and I had done a master's degree in public health epidemiology. And I've worked as a nurse in a bunch of different capacities around the world. I worked in mental health and addictions, briefly in plastic surgery, home care, neurosurgery, public health, sexual health, lots of different places. So when I came to the faculty, I very quickly started teaching in our mental health and addictions course. And then I've also taught our Indigenous health, our leadership courses, and contributed to our EDI committees and the curriculum committee, a bunch of different things. I'm also like a very involved student. I am vice president of the Indigenous Graduate Students Association, and I do some community-based work with the Métis Nation of Alberta and Métis Nation of Ontario and the Edmonton Two-Spirit Society. So I keep pretty busy.
Yeah, Keith, one of the places that I remember seeing you was when the Métis Nation of Alberta did their first COVID shot clinic.
Yes.
So I wonder if you could talk, and I know a big part of your work and being and as a human is about community engagement. So I wonder if you could tell us a little bit about the community engagement and how that continues to shape your practices as a researcher and as a scholar.
Yeah. So, I was working away on my PhD in teaching, and then 2020 rolled around, and the COVID-19 pandemic, kind of interrupted all the things that we were all doing around the world. And I was grateful to have relationships with the Métis Nation in Alberta. And, it was such a interesting time as an epidemiologist and a nurse, but it was also such an important time as a Métis person, because we knew so little about what was happening in terms of the disease and how to prevent it. And I think we were very fortunate in Alberta that the Métis Nation took really quick steps to try and help in different ways. So like the first thing that I sort of did with the M&A for helping out was developed a video series on mindfulness-based stress reduction, because everyone was very, I think, freaked out by the pandemic at first. So I created a short little video series on different ways to manage stress during the pandemic and to communicate. And then as things rolled around and we eventually got vaccines, I began vaccinating for Alberta Health Services for the pandemic. And then when the Métis Nation got their vaccine clinic approved, the health department and I worked together to help deliver those first Métis-led, well, the first Métis-led vaccine clinic in Canada. And what was really cool about it is we wanted it to be like other Métis gatherings, even though we couldn't gather at that time. But we heard from community that that was one of the things that we really were missing was being able to get together. And that was a big impact, I think, for everyone, but especially for Métis people who, were used to getting together with family and friends all the time and, generally have large families and stuff. So we tried to make the vaccine clinic as friendly and communal as possible while still doing all the safety things, masking, social distancing, but also getting those life-saving shots into people. We had music, we had slideshow, the fiddle was going, and then we had bannock and jam for everyone as they left. So we were really trying to create that community environment in a situation that wasn't ideal. And I think some of that has really informed my academic work too, because it was through some of those community connections that I've been able to really expand my thinking about what it even means to be Métis in Alberta. Because what we saw at that clinic was our Métis families are very diverse. There were people coming from settlements, from urban centers, from rural places. We were vaccinating their partners who also came from all sorts of different backgrounds. We had First Nations relatives, we had Inuit relatives, and it was just a really beautiful demonstration of the diversity and complexity of what community means for Métis families. And then because we were vaccinating for COVID-19 then, and my primary academic research is around HPV-related cancer prevention, which is also vaccine preventable, it really helped to sort of start informing my thinking about what a Métis family looks like and how my Métis family may differ from the different types of Métis families across the province and across the homeland. I think that's sort of one of the ways that the vaccine clinics stuff has informed my work.
Well, I sure have appreciated the article that you wrote on that whole process. I use it in my course on Indigenous health, so it helps the students, the future health students and future nurses, to think critically about what that can look like as future health practitioners. So one of your articles that you've published on the Métis perspective of the whole COVID and the vaccination process is part of my syllabus.
Oh, that's really cool.
Yeah, so it's another great contribution, and another way that we can contribute to scholarship is by sharing and writing about those experiences that are very natural and normal to us as Métis people, right? To come together, to gather. I didn't get to go to the COVID vaccination M&A, but I heard from my own family how they appreciated arriving, and then there's the fiddle music playing, and just the burden or the kind of struggle with COVID was lifted for them in those spaces.
What was really interesting for me was seeing elders coming in, mothers and their children, people were coming, and because of the music, because of the welcome, we also had like doctors and nurses like myself who were Métis, greeting people in the line and answering any questions they had. And that made a huge difference, I think, for people who might have had some hesitancy or weren't sure what the best thing to do was for their health, because they were able to talk to somebody who had a bit more knowledge and who they could relate to as a fellow Métis person, because there was a lot of hesitancy, I think. The other great thing that I heard from that clinic and from the other clinics we did is because we partnered with the local health authority staff, and the staff, like myself, who'd been out vaccinating, we were often in like very sterile environments, no music, no joy, just assembly line vaccines. And what the staff said that were vaccinating was like, what a great experience. Like, why can't all our vaccine clinics be this much fun and this much like joy and community and people laughing? And because the assembly line technique might be useful for getting a lot of people vaccinated in a short period of time, but it doesn't really engender that like sense of comfort and trust in the system. So I think it was a really cool sort of model for future work. And I know some of the staff from the health authority took that away with them and were thinking about ways of making their vaccine clinics more comfortable. So it definitely felt good to hear that feedback, and also to hear feedback about the writing that we did about it, because it's great to hear that that's being used.
For sure, because we're never quite sure where our writing will land sometimes,
Right.
right? It can
Yeah.
become
Does
very,
anybody read it?
that's right. And it's, when you talked about, when you introduced yourself and said your mom was a nurse, your grandmother researched, so you come from from a line of matriarchs who've worked in that health field.
Yeah, absolutely. I'm
How is
so
that?
grateful.
Yeah, yeah.
I honestly, and I always talk about them because it was and is, I think, often in our families, our mothers, our aunties, our grandmothers, who help shape who we become as people. You know, so many of the things I learned about kindness and compassion and caring were things that I learned from my mother and my grandmother and my aunties. And you know, uh, Cindy, your own work. The first time I read the Kyokewen, the Visiting Way article, like it brought tears to my eyes, because as a kid, I was the little kid around that kitchen table with those aunties and my grandma and my mom, and the food and the cigarette smoke and but that's where I learned how to be a person, a person in a community, a part of something bigger than myself. And it's so beautiful to work in this way, because when I was trained as a nurse, they teach a lot about professional boundaries and not using too much of who you are um, as a nurse. And that really went against how I grew up and how I related to the world. And you know, I've followed my traditional ethics my whole life, and it's definitely, I think, served me well in my career, because I refuse to not bring my whole self to my work.
Mm.
And my grandmother and my mom and my aunties demonstrated that to me.
In many ways, then the influence of your community engaged research goes back, as we often talk about LETAB or kitchen table, how that we're bringing that in our work, in our work within the academy, because it's all such a good way to put it, to think about it's bringing our whole selves, but those relationships that have shaped, right? And I
Yeah,
wonder how it would have shaped their work as nurses as well. Like that generation, wouldn't it be amazing to hear from that generation of those women that have shaped their practice and continue to shape our practice? What do you think they'd say?
I think that they would, my grandma passed away, but I think she would be very proud of me now, because like that kitchen table was a safe place for us all to be ourselves. But I think that when my grandma went to work as a nurse, she had to hide a lot of herself because of the time and place that she was. And I think my mother also had to do that for a period of time, because I think the experiences of Métis women were different, 30, 40 years ago. And I think that they would be very, very proud of how far I've come and how far we've come, because even when I started nursing school, there was nothing about Métis health in the curriculum. There was an example in one of our courses of like a very deficit discourse around Indigenous people's lives. And I think that narrative is also shifting, and that's thanks to research that we're doing here at the U of A, that is showing Indigenous ways of knowing, and rejecting the deficit stories about our families and saying, these are also our strengths. These are also the ways in which we persevere, and this is the beauty and and knowledge and gifts that we bring to the table. And I'm really grateful to be a part of that here.
So Keith, that just draws the question out of me. How did you decide to pursue doctoral work? Given that you're busy, you've got this um, multi-dimensional career. How did you come to make the decision to start doctoral work?
Yeah, I finished my master's research in England. I lived in England for 6 years, and I took about a year off just to work in the UK. And then I decided I was going to extend my master's research into a PhD there. And I applied and got in and started. And then there was some political stuff that happened in the UK, and the funding for my research project got canceled. So I ended up coming home, and I sort of thought that I was done with academia, because I had quite a bad experience with that process. And then I came home, and for me, it was also like coming home in many ways, because I'd been living out of Canada and away from the homeland and away from my family for many years. And so coming home, it was like starting all over. I came home with a new set of skills, a new sense of who I was, and I had to rebuild relations with my family and my community here. But it was such a beautiful opportunity, because what I found was, after being away for so long, so many people welcomed me back with open arms and were really willing to figure out who I was and where I fit now. And so after a few years of being back home, that passion to like want to learn and contribute really kind of came back. And I was working in the health system, doing some quality assurance kind of work, and it wasn't really fulfilling my heart. And that like craving to learn more and to contribute more really was coming up. So I applied to become a teaching professor here, and I was successful. And then I told them that I wanted to do a PhD, and the faculty was really supportive of that. So, a year or two, I think it was 2 years after I started teaching, I applied and was accepted. And, that process again, it feels like it was just the natural progression. And then when I started doing my PhD coursework, that's when I really started connecting my Métis heritage to my passion for my work. I was like, this is an opportunity for me to give back. And that's also been just such a wonderful experience.
Yeah, that's really beautiful, Keith. And I'm trying to remember how we came to first know one another, and that I don't remember if it was around your research, if it was around the Indigenous Graduate Students Association, if you dropped in for a tea at one point.
I remember exactly the moment we met.
I would love to hear the story.
You walked into the CIHR Gender-Based Analysis Plus workshop that was being run in, I think, one of the buildings that I never go to. And I had a hard time finding the classroom. And I think I was a bit early, and I sat in the back row. And then you walked in and you reminded me so much of some of my family members. And there was a seat next to me, and I moved over so that you could sit there. And we started chatting. And I didn't know you were the vice provost of Indigenous or anything. And we just started chatting. And then a few months later, I was thinking about committee work, I think. And that's when we like formally began a relationship. But I'll never forget, because you walked in and you were just this like kind, beautiful, like you have an energy about you, Florence. And I'm so grateful we sat beside each other that day.
Well, so am I, Keith. And And just because I get to be a part of your doctoral journey now, I really appreciate that. And I was wondering if you wanted to share a little bit about your doctoral work and what was your research? What is your research puzzle? What are you inquiring into? And I know that you are in the midst of doing data analysis, but what is the framing for your research question and
Yeah,
research
so
wonder?
you bet. My research is really focused on HPV-related cancer prevention. So I've been working in sexual and reproductive health for probably the last 10 years of my career. And my sister's given me permission to share this, but when we were younger, she had a cancer scare with cervical cancer. And those were a very scary moment for us as young people because, first of all, it's terrifying when anyone gets cancer, but when you're like 26 years old, it's really out of left field. And that that experience sort of is one of the things that shifted my interest into sexual and reproductive health because, it had long-term impacts on my sister and our family. And when I came back to Canada and had to start thinking about what I wanted to do for research, I knew I wanted it to be sexual health related. I knew I wanted it to be like emphasize the experiences of people with HPV related cancer. And through my coursework and committee discussions, the question really got shaped on what are Métis families' experiences with HPV related cancer prevention. And when I looked to the literature, there was nothing. There was nothing written about how, like, whether Métis people are vaccinated or not vaccinated, or if there's any higher rates of cancer or lower rates of cancer. There's a real gap in the literature around Métis people. And I think that goes back to, the different colonial systems that have, excluded us in some ways from federal research funding, and then being lumped in with the general population in the provincial health system. There's no way of sort of separating out data about Métis people. So there's real gaps in the literature. And when I saw that, I knew where my focus had to be. And then on top of that, being an epidemiologist, I started thinking about the math and the numbers, and also thinking about how Métis people relate. And I wanted to be able to tell a more complete story. So my PhD research is comprised of three parts. I did I wouldn't say it's a community consultation, but a survey of Métis people that asked them about their attitudes and beliefs related to HPV and HPV-related cancer prevention. And then we're doing an admin data analysis, like a more epidemiological study, looking at the rates of vaccination for Métis families in Alberta. And then the third qualitative component, which uses the visiting way to go and sit with families and hear about their experiences with our public health system and with the school system and with HPV and cancer and that I think the three parts of that study are really going to provide a very rich picture of how things are for Métis families in Alberta when it comes to HPV related cancers.
Yeah, thank you, Keith. The work is fascinating. And I think about that so much just given my own family experiences and yeah, I think it's going to be very interesting. And I'm really appreciative of having you describe why is the data not there? Why are there so few research studies that are Métis specific, right? And you've helped to illuminate the way that data is collected. And yeah.
And even like administrative data, like our vaccine databases, it's so interesting because depending on how an administrator in our health system codes a person, like for example, if they assume they're First Nations or, so when we look to the data, we have to do these cross references and data linkages with the Métis registry, which we know is also incomplete. So we already know going into this study, which is going to be probably the first comprehensive look at this, but we already know there's significant limitations in this study's method because through my visiting work, my qualitative work, I went to the settlements and I heard from Métis families that live in settlement who are not members of the Métis Nation Registry, but are many generations Métis and live on the settlements. And so we know that even within our own nation, there's gaps and disparities in the way information is collected and shared. So I'm as excited about the findings of this study as the limitations that we're learning about, because it gives us an opportunity to possibly do some work to try and mend or fill some of those gaps as best we can. But it's been just amazing learning.
Wanted to pull a bit on that thread in terms of the Métis specific health research. And as you know, Keith, we've just completed a 12-year scoping review on Métis women's health specific.
Right.
And what becomes quite evident in that research is also who is conducting the research, right? The framing when it's Métis people doing Métis health research will look entirely differently in terms of how we even think of notions of data, how we even frame the stories, and in what lens we're applying to give a voice to, right? That shifts out of that deficit, but also, it's like we're still kind of in the analysis, but there's a subtle erasure that occurs depending on who's doing the research, right? Because there's a whole context and not complicity, but complexity that you described in terms of Métis identity and our Métis families and our Métis communities, that unless you're part of or on the ground or unpacking it for your own self with one another, because I think that's another piece that we do differently in terms of our methodology is co-creating together. Like a lot of our work is in relation with ourselves, with one another, which also again changes maybe output's not the right word, but the way in which the picture is perceived or presented.
Absolutely. And that was something that really stood out for me as I was going around meeting with families. Is like also the context of the land, the places people are from, how far they are from where they were born. Like all of those things play a role in some ways, like their relationship to their place. Because I know I was talking with some Métis families in southern Alberta, and they were talking about how having moved to the south and away from places that were more traditionally Métis, there was there was a feeling that they were outside of like the Métis homeland, even though they aren't, but yeah, I can't wait to write and publish some of this with the permission of the families. But there was such complexity, like you said, that complexity is really important when it comes to describing Métis people's health, because their relationship to place and people and community become important factors in how they decide and act in relation to their health, it seems.
And that methodological work will be important at health research because there's so limited approaches of Métis specific ways with that intersectionality piece that you're clearly kind of putting together, right?
Yeah. So that's one of the things I'm really excited about is, in the survey research, we captured probably for the first time demographic information about Métis people's gender. Because in health research, there's a lot of mixing up of sex and gender in the research. Like a researcher will collect whether a person is male or female, or assigned male or female at birth, and they will then write in a bar chart halfway through the paper that, this is their vaccination rate by gender. Well, contemporary thinking around sex and gender is that sex is like a biological state that someone has related to their genetics or their their physical, biological body. And gender is like a construct that is more determined by who the person sees themselves as and how they relate to others, or express their gender. And so I think my study is going to be one of the first studies of Métis people that captured both their sex assigned at birth and their current gender. And one of the beautiful things is the diversity that again we see there, which to me tells us that we have to do more nuanced health research, because all of that research that was done that just looked at sex as the sex assigned at birth has ignored the complexity of people's identities. And we know already that Métis identity is complex. And so as we add in these other factors that influence the way we interact with the health system and our health, it really adds to the complex tapestry of our nation's and our people's lives.
Wow, that's really beautiful, Keith. I'm sorry, I'm just caught in the thinking about that. And I'm thinking about the families that have contributed to your work. I'm thinking about the beautiful complexity that is emerging in your work and the nuance that is so necessary for health research. So thank you. I do realize we're coming to near to the end of our time, and we always like to invite the guests on presenting our presence to say any final words that they would like to share with our audience.
Final words. I should have prepared for that. I think the final sort of message that I'd like to share about my research and health research with Métis people is that it really needs to be grounded in and informed by the Métis people who are involved. From my work, I have already been told that Métis families that I visited with want to get together and talk about what the findings were. And so, we're having to reshape how we finish out this project because I want to honor that request. Métis families want to learn together about this, so let's bring them together. And so I think that's probably the key thing for me is on a go forward. I don't ever want to do research that doesn't involve the people in the process of designing the research, because it's been such a wonderful experience being able to do it in this way. So that would probably be my main takeaway.
Yeah, Keith, that's again really powerful and really beautiful. And I just want to say it's been such a gift to have you with us today. And to the listeners, I want to just share like when we first turned on the Zoom meeting today, Keith talked about the shirt he's wearing. We are recording this session in December. And although it won't be released for a few months. So, Keith, why don't we end with your shirt is the University of Alberta Christmas
Yeah.
sweater. And it is very beautiful. You've got a beautiful pair of earrings on. And I think you shared with us that that is Tawau.
Yeah.
So welcome. And it's been an honor to have you with us today and to learn more about your research and to learn more about the work that you do within our communities to support the ongoing health of Métis citizens. So thank you, Keith.
Thank you, Florence and Cindy. This has been a really good experience.